Hi everyone, I hope you're enjoying the antenatal classes practical session. And I just wanted to take a few minutes of your time just to tell you about an exciting new service that we've recently launched here at Parkview. I'm delighted to share that we have started to offer post-natal home midwife visits. I'm going to explain a little bit about the service to you now, hopefully we'll answer all of the key questions that you have as best as I possibly can. So, a little bit about myself. So, I am the postnatal maternity coordinator and also the home care midwife here at Parkview Hospital. I am a UK registered midwife and also a UAE registered midwife. I've got around about 13 years total experience of working as a midwife, both here in the UAE and also in the NHS in Scotland and in England. I also completed my IBCLC qualification, which means that I am a fully qualified lactation consultant, and that was around about 3 years ago as well. So let's get into the nitty-gritty and talk to you a little bit about the why midwife postnatal home visits are really important. Well, you know, having a baby is a very exciting time. Your baby arrives, you're overjoyed, but also the first couple of weeks after birth can be really quite challenging. Lots of emotional highs and lows, not sure, you know, not feeling confident or sure that you're doing the right thing for your baby and the right thing for your recovery. So midwives, the purpose of the service is that midwives would come to your house, they would provide education, advice, they would perform clinical assessments on you and your baby, and support you in your transition into parenthood, and be there in those early days when you need the most support. What happens when a midwife comes to visit you at home? Well, we'll go through the list that you can see on the screen now. So basically, the care and the support that you've had whilst being in the hospital, we continue that in the community in your home setting. So it means that you would have a midwife who would come out to you. They would perform a postnatal assessment, so a clinical check of mum and a clinical check of baby, just to make sure that everything is normal, mum is recovering well and baby is thriving. Included in those checks would be baby weighing facilities. We would also do feeding observations, assessments, and provide sort of lactation support as and when required. Emotional support, because lots of hormonal changes are happening in this immediate postnatal period. Basic wound care, so for those of you that do have cesarean sections, just making sure that your abdominal wound is healing really nicely. And if there's any perineal tears that have been sutured at delivery, then making sure that there's no signs of infection and everything is healing nice and normally as expected. Also, just giving you general advice, tips, education about what to do if you think that you're feeling unwell, if you're worried about your baby's health, and of course, some vital information about baby safe sleeping guidelines. When does a midwife typically come to visit you at home? Well, our visit schedule is planned around the UK system of postnatal community midwifery care. And that basically means that we would come out to see you in the home typically within the first 14 days or after having your baby. Now, we're following a sort of schedule where we would like to come and see you 3 times after the birth. And a typical midwife visit schedule would be that the first visit would happen somewhere between 5 to 7 days after giving birth. The second visit would be between 7 to 10 days, and the final visit would be between 10 to 14 days. Of course, this is a kind of rough schedule that we will try to follow, but depending on the needs of the mother and the baby and the midwife's clinical assessments, there might be a slight deviation out with those times, just depending on the needs of the patient. So how do you book home care visits? So if you're interested in availing this service and you would like a midwife to come out to your house after you've given birth to provide this education and this sort of vital support, then you can raise your interest on the maternity ward after you've had your baby. I will then come round and visit you in the morning of your discharge to confirm your first visit day. And we will collect payment and settle all the bills for the home care service just before you go home. The day before your scheduled day of visit, I will then contact you to confirm which appointment slot you will have. So we don't give specific times in maternity home care services because we were out in the community and there's different variables affecting the service. So we will either give you a morning slot, which is typically before 12 o'clock, or an afternoon slot, which is after 12 o'clock. At the moment, the burning question everybody wants to know, so what are the costs for this service? We currently offer two packages, and they are as follows. So one package is for 3 visits, and that follows the typical midwife schedule and that I've just discussed, and that's 1,300 dirhams. We also do ad hoc one visit. So if you didn't want to take the package and you just want to have one visit for reassurance, we do offer that as a service for 500 dirhams. It's important to answer some key questions that you may have at this point. The midwife postnatal home care service is fairly new, and therefore we do only offer at the moment for part-few mums and babies. And we do have a sort of geographical limitation as well from parcel in terms of distance. So depending on where you live, we don't cover Abu Dhabi, for example, Al Ain, and certain areas of Dubai. And unfortunately, as it stands at the moment for home care services within the Emirate of Dubai, they are not covered under insurance policies or packages. So thank you so much for giving me a few minutes of your time just to discuss this exciting service. I've been working really, really hard behind the scenes, and I'm so happy now that we've launched it and we're out there and we're able to help you guys as you transition into parenthood. If you do want to have any more information, if you do want to ask any specific questions that I haven't covered, then you are more than welcome. We'd love to hear from you if you contact the maternity coordinator email address, which you can see on the screen now. Alternatively, you can also get in touch with the call centre and they will revert any of your queries or concerns to either myself or to Eve, who's the antenatal maternity coordinator. Thank you so much. And I do really look forward to hopefully meeting quite a few of you in the next couple of weeks and months and visiting and supporting you at home.